We are back with another quick vlog here. Wanted to touch a bit more on what I would like to call pre and post-op care. Just some things that you can do to give yourself the maximum benefits of healing in your surgery process. So I would like to start off with the disclaimer of I am a retired healthcare professional. However, I recommend that people do their own research and their own due diligence in what I would like to call their personal health care. And the reason that is everyone is different. I know that there are a lot of people out there who advise people that they can take this and they can take that because it's natural and things of that nature. Just because it's natural, just because it comes from nature, does not mean that every and anyone can utilize those things, as far as their health and well-being. We were all beautifully and uniquely made. And so sometimes there's certain things that individuals may have a sensitivity to, even allergies to, so much so that it can cause them anaphylaxis or things that can cause a person to swell and even stop breathing. And if, not treated in time, they can die. So I would recommend people doing their own research and studies to find out what's good for them and what's not. Before I get started in this vlog. So we're coming up on Operation Day. We've got 2 more days. I'll be going in on Thursday. I'll be going in Thursday morning, probably mid-morning, and they'll probably start my procedure early afternoon. Like I said before, the procedure they said should take about 2.5 to 3 hours. So I'm going to be under for a while. But before we get started, as I was going through this time of kind of stillness and silence, I was just sitting there thinking, like, what is it that I can do on my end that can give myself the best chance of recovery? So I went and did some research on some things. Some things I already knew, but just kind of wanted to circle back around to see what those benefits were and if there was anything that I could do to increase the efficacy of the things that I'm already taking on a day-to-day basis. So we'll definitely start in with like prep. They want you to between 72 to 48 hours before to start prepping with things like using, if you don't already, using things like Listerine, any type of antiseptic, just so that you have really healthy bacteria in your mouth, and to eliminate as much of the bad bacteria in your mouth as possible prior to your procedure. And usually the reason is that they're going to be sticking tubes and things of that nature down your throat. And so if there's any type of bacteria that's not good for us that are there, and if they, by any chance scratch your throat, just sometimes because the tubings can be a lot bigger than most people's airways. And so we want to kind of alleviate as many chances of possible infection as possible. So anything like Listerine, any type of antiseptic, they prefer you to, kind of start doing a few days before your procedure. Also like antibacterial soap, again, to try to alleviate some of the surface bacteria. Of course, bacteria in our mouth or body or anywhere, not all of it's bad, but some of it that sits on our surface of our skins and on our, on our body, if there's a cut or an opening that's usually not there, it could, again, increase the chances of any type of possible infection. And they just, again, want to lower that chance as much as possible when working in a sterile environment such as like an OR. The night before the procedure, they give us these when we go to pre-op. And basically, if you've ever heard of Hibiclens, the bacterial, like professional grade bacterial wash, it's the same chemicals that they use in Hibiclens that they have in these wipes that they want you to use the night before your procedure. So after you take your shower for the night, you want to wait an hour and use the wipes. They have like this patient care sheet to show you where they want you to do it. You do not ever want to use these on your face. If you ever purchase Hibiclens, it's just the same thing as well. You don't put it on your face because this can cause lots of irritation. So they have you to put it on your neck, your arms. They have for each wipe, there's like this sheet that lets you know what, because it's only 6 sheets that usually comes in these. So they kind of let you know where they want you to use each individual sheet when wiping your body down. And then just wait a little bit before you put clothes on, because it can be like sticky and uncomfortable. So I would probably just air dry after doing that for a little while, just so that you don't feel really sticky and nasty on your body after the fact. Again, they're going to disinfect your skin and everything like that, and prepare your areas of your body that they're going to do the procedures on to a sterile feel. But they want to just make sure that you're doing as much as you can on your end, again, to lower any chances of any type of infection, because studies have shown that there are certain infections that do happen when in the hospital. And they, again, want to lower that as much as possible. So anything that you can do on your end before, I would recommend highly, highly, highly to do so. Jewelry, earrings, rings, things like that, they want you to not have those on the day of the procedure. I have a nose ring. I asked them about that. They said, I can keep that in. That's fine. Thank God. This is my 3rd piercing. Really don't want to go through that process again. They said they typically, put like a surgical tape over it so that you don't lose your nose ring, hopefully not in your body or anywhere else in the operating room during the procedure. So I was like, that's great, because the piercings on your nose tend to close pretty quickly. I don't care how long you've had them. So and contacts, if you wear contacts. I do, because it's just a lot more comfortable for me, apart from wearing glasses. But the night before, I am definitely going to take off my contacts and wear my handy dandy glasses the day of procedure, just so that I'm able to see while going there and things of that nature. I have already packed all my things, so I do have a spare set of contacts after the procedure that I can pop back in after the fact, because I really don't like wearing my glasses. They just feel weird. I don't like the idea of not being able to see everything, and they're not as clear as wearing your contacts. So excuse the noise outside. They're doing the lawns. Grass has gotten up pretty high in the past couple of days, even though we've not had any rain. So wherever any of you have rain, please, please, please send some your way. And for my friends and family in Texas, my heart and spirit goes out to you and any loved ones that have experienced any loss during the floods down in South Texas. I've been kind of keeping up on the news with that, and it's just, it's been a horrific time for a lot of folks down that way. So my heart and prayers do go out to you. So we have our glasses, we have the wipes that you used the night before. They'll usually tell you to, if you're taking any type of supplements, they usually tell you to kind of discontinue those the week before. So I've discontinued those, some of the supplements that I have been taking, and they don't want you, of course, nothing after midnight, so I have to go all gizmo Wednesday night, after 12 with nothing to eat. You can have something light to drink just to stay hydrated, but they recommend it be clear and nothing red, just in case, you get sick or throw up for whatever reason. They're not mistaking you coughing up or throwing up blood, because we definitely don't want that to be an issue as far as them making sure that they can do the procedure in a proper manner. So nothing red, the day before. So I was like, got it, no fruit punch. As far as once I go home, I have a regimen that I already intend on starting for myself, using a few supplements. I'm already on vitamin D2, 50,000 units every week, because I do have low iron. So I've already been taking that for the past few months now. The benefits that come along with vitamin D are very vital in the healing process. Vitamin D has a lot of different properties. One, of course, it helps support calcium absorption into the body. So that's always very important, especially when, a good bit of our body made of bone. So when you're trying to have bones fused together, that will definitely be helpful to that process. Also, with vitamin D, studies have found that it helps with your inflammatory and what we call a histamine response. Anytime you get a bite, like a mosquito bite, or you have allergies and things of that nature, our body whelps. Vitamin D helps to decrease that happening in the body. So it's really helpful with the whole helping to keep a lot of the inflammation down or away before, during, and after any procedure. And again, along with the calcium absorption. So I already take the vitamin D2 once a week, so I don't really have to do too much as far as an extra supplement when it comes to that. But it will help when I'm using other products. So I have a couple of products here. Again, I implore everyone to do their own due diligence to find out what works for them, what doesn't work for them, because we're not a one-size-fits-all situation. I took my time to research what would be best for me, and as far as my healing process during this journey, you can find any of the items that I will show on Amazon. I'm not going to put any links down in the description box, again, just because of the simple fact I know that we get excited when we hear different things, and we'll just go and go purchase things without doing our part on figuring out whether or not that's something for you. So like I said, I'm just gonna show a couple of things and explain as to why I'm using those products in my healing process. So we will start with psyllium husk, which is just basically pure fiber. I like the capsules only because it's not as messy, as opposed to doing the powder and then waiting for it to kind of chelate or get all gelatinous. I have used the powders in the past, but typically I use the powders when I am doing things like fasting, just to kind of keep my body full. When I'm going through my fasting, whether it's for personal, spiritual reasons. But only reason why I recommend psyllium husk, because not everyone's bowel movements are regular, and especially after having a procedure, they're using all kinds of pain medications, and pain medications tend to slow things down, especially when it comes to the digestive process of things, which in turn typically slows down any type of bowel movement that someone may have. So I highly recommend for myself taking this daily, just to make sure that I'm having very regular movements, because we definitely don't want anything obstructing, causing any type of strain, especially when we've got all this healing going on here. The psyllium husk, again, I typically take first thing in the morning, about 5 or 6 o'clock in the morning, and I recommend anyone who has taken psyllium husk or intends on taking psyllium husk in the future, you want to take that either 2 or 3 hours before you take your medications and or supplements, or 2 to 3 hours after. The reason that is that psyllium husk is highly absorbing, and so any medications, any supplements that you take and you take that right after, it's just going to absorb all of the effects of whatever it is that you're taking, especially people who are taking things like thyroid medications, anything for blood pressure, diabetes, even for your moods. You definitely want to wait to take those medications when you start taking your psyllium husk. So about 2 or 3 hours later, I go on with my regular day, taking my other medications. Like my Cymbalta, it kind of helps with my moods because I am going through perimenopause right now, and it also kind of helps with some of the nerve issues that I have, some of the neuropathies that I have. So I started taking that, and then I have here my multi-collagen, and I purchased the type 1, 2, 3, 5, and 10. The reason that is this helps with a little bit more. It also helps with the bones. Usually the 1, 2, 3 typically only helps with like nails and hair and skin. This one is just a little more broad spectrum as far as what it does to help with healing of the wound sites and giving extra collagen to your body and just making your skin look all nice and youthful. So it's kind of like I'm getting everything all in one with this one. Scoop a day works. You can put this in your water, you can put this in your teas. I will probably be putting mine in my smoothies only because it'll just be like a one and done situation. I have to do smoothies anyway for a little bit just because of the dysphagia that I'm going to have with swallowing, so this helps. But to increase the efficacy of the collagen, you use vitamin C powder. So this is just pure ascorbic acid. Again, Amazon. You do about 1/4 a scoop when you're doing this, and it just makes this a lot more effective with the healing process. So 1 a day, and it's also helping with my immunity as well. So it's like I'm killing a whole bunch of birds with one stone. And just to go back to the vitamin D also helps with immunity health as well. So we definitely appreciate having that on board. So it's those two that I do a couple of hours later after taking my meds and putting that in my smoothies for today. And then I end my evening with magnesium 10-in-1 complex here. And I only do the one. You can see how your body does doing it 2 a day, like first thing in the morning, later in the evening. But for right now, I'm going to just start with doing it in the evening. And the only reason why that is because it does help with muscle and nerve issues. It kind of helps to calm those down a bit. So, and it also helps to relax your body for sleep. So after a long day of sitting up and being stimulated, that'll kind of help calm my body down and kind of send those signals where they need to go to say, hey, we're preparing our body to rest. As much as being active is very important, honoring times of rest is just as equally important, especially in the nighttime, because that's when our body's doing the most work to regenerate and heal. So I want to definitely honor that as much as humanly possible during this progress, especially knowing that I'm going to have another procedure in the next 3 to 6 months for my lower back. So these are just a couple of things that I have decided to implement in my healing process during this surgical journey. I've also created a month-to-month journal that I will put down in the link, as a link in the description box. Anyone, as of right now, free to use at your leisure. It is definitely customizable to you, as far as your schedules, just to make a note of everything that it is that you're doing. And it's also helpful for you to kind of help keep track of what it is that you're doing, what works and what doesn't, how you're even feeling during this whole process, because it's not just about the physical aspect of it. It's like, how are you feeling emotionally? How are you feeling mentally? How are you feeling spiritually? All of those things matter. And it's allowing you to do like daily check-ins with yourself as to where you are, because the days, they fly by. We kind of get busy with certain things, and then we tend to forget, especially when we're doing our follow-up visits with our doctors. They're asking, hey, how have things been going? How have things been doing? We always normally default to everything's okay. And then when we leave the doctor's office, we have 50 million questions as to what we wanted to ask the doctor after the fact. So this journal that I came up with is very beneficial in that regard. I'm able to just kind of jot down, okay, when I'm taking certain things, how I'm feeling. I can track my bowel movements, if I'm having any type of movements, things of that nature. Because those are some of the things that the doctors do tend to ask, especially after procedure, because they are all very important, right? So I will have that down in the description box. Whomever is having a procedure or anything of that nature, even just for simple regular check-ins with yourself from day to day, you're able to use it. And that's like, my gift to you all. It's just, again, in this season, I'm just wanting to be a lot more aware when it comes to particular things going on with me inside and out. And I feel like this is a nice little tool that can help with that. For the most part, that is it, like in a nutshell. Again, retired medical professional. Still do your own research, because we're all different beautiful creatures, and what works for me may not necessarily work for you. And I would hate for anything to happen to anyone out there adversely because, well, this person said such and such and this person said so and so. Do your own research. Make sure you're doing your own due diligence, honoring yourself in that process, and trust your instincts. If you feel like something, may not be right for you, 10 times out of 10, if that's what you're feeling, if that's what instincts are coming up to you, you're probably right. So learn to trust that. Learn to trust that whatever he has for you is for you, and what's not is for somebody else, and it's okay. I'm really excited because we're, again, getting closer to that date. Today's Tuesday. 2 more days. I'll be heading down to Augusta for my procedure, and probably will check in a little bit before that procedure. And again, thank you guys for just sitting down and taking the time with me during this journey, and I hope that something resonates with you in this. And if you have any questions, feel free to just put them down in the comment box below, and I will try to get back to you and answer as many questions as I can. And if I don't have the answer, I'm okay with saying I don't know, but I will find it out for you, or find a link or some place that you can go to find those answers that you may be looking for in your journey. You may not necessarily be getting the same thing that I'm getting, but you're probably almost in the season of having to get something done. So I'm always here to help. And thank you again for taking the time to just sit and listen, and hopefully you got something out of it. And until next time, peace.